Good afternoon and welcome to this first Educators Rank and File Committee meeting. My name's Thomas Scripps and I'm a member of the Socialist Equality Party and a writer for the World Socialist website, and I'll be chairing the event today. We're here to discuss the unsafe reopening of schools, the threat that is posed to school workers, their families and their communities, the role of the Labour Party and the trade unions, and a programme of action for educators to fight for their safety. Thank you all very much for your attendance. We've had registrations from all over the country. We're looking forward to hearing from you, your thoughts and experiences and questions in the discussion. Before then, we have a series of short reports and contributions prepared by an international panel of speakers working in education or with expertise in medical science. We have very deliberately assembled an international platform today because precisely the same issues confronting teachers and parents in the UK are right now being faced by millions of others across the globe. There's not a country in the world at the moment which has not already, or is not now, engaging in the same forced drive back to the classrooms as the reports at this meeting will indicate and explain. Now, if you would like to respond to any of our speakers, please either enter a question in the questions panel to the right of your screen, where you should have a series of drop-down menus, and I will relay that question at the start of the discussion. Or you can raise your hand to speak by clicking the hand icon in the top right of your screen near the mute button, and I'll call on you to speak when it's appropriate. I'll go over those instructions again when we come to the time for the discussion. Now, at this point, I should emphasize this is the democratic forum, but it is also a partisan forum. We are not going to subject our listeners to any far-right rubbish denying the existence or severity of the pandemic, and I will use my power as chair to mute anyone who joins with the purpose of spreading reactionary stupidities. The pages of the Daily Mail and the Telegraph are open to them, but they are not having this platform. We are not engaging in a dialogue with stooges of the Tory government. We're organising a fighting opposition against them. And on that point, I'd like to introduce our first speaker, Tanya Kent. Tanya is a long-time member of the Socialist Equality Party and a special educational needs educator from England. She will explain the purpose and programme of the Educators Committee. Welcome, Tanya.
Thank you, Tom. I'd also like to welcome you to this meeting and extend a special thank you to our international panelists for their participation. As Tom has noted, the need for an international struggle against the pandemic and the establishment of links on a global basis is an essential element in the fight to demand the closure of unsafe schools and to protect lives. In the statement that was published yesterday on the WSWS, the online journal of the SEP, we said the drive to reopen schools has become the focal point of the class struggle in countries throughout the world. The attempts by the ruling elites to force teachers and students back into classrooms in order to force parents back to work producing profits has been met with growing resistance by educators, parents, students and the broader working class. The aim of this meeting is to provide this growing global resistance, including within the United Kingdom, a conscious programme and an instrument through which it can fight. The launching of the Educators Rank and File Safety Committee to organise a national strike is the only viable means of uniting opposition to the homicidal policies of this government and governments the world over. This is a partisan meeting. We stand wholeheartedly behind the multi-million masses whose lives have been shattered in so many conceivable ways as a product of this pandemic. Sorry, but we are not all in this together. This is the poor man's virus. The impact of this pandemic on the poorest, most disadvantaged, most vulnerable has been nothing short of a tragedy. Over 350,000 have died across the globe officially, and there are some over 41,000 in this country alone. Deaths which were entirely preventable, but for the criminally negligent policies of the ruling elites the world over. Now, whilst the virus has spread predominantly in the poorest sections of the working class and neighbourhoods to poor families who have had to go to work and live in close proximity to each other and to their children of these workers, at the same time, the virus has been a godsend for the rich. In the midst of a deadly pandemic, the billionaires the world over have had a bonanza. In the United States, for example, they have increased their wealth by some 282 billion. Amazon chief Jeff Bezos has increased his wealth by over 25 billion in 4 months from January to April this year alone. Never in history has any individual made so much wealth in such a short space of time. It is this class reality that underpins all aspects of the response to the pandemic by governments, which have been characterized by a total disregard for the health, safety and well-being of the vast majority of the population. The reopening of schools from September the 1st in the United Kingdom is part of this agenda, to increase profits for the rich through forcing teachers to childmind so that their parents can return to work for the extraction of profits for the wealthy and nothing else. As you will be aware, more than 1.5 million education staff and over 10 million children will have returned to unsafe schools over the past week. This takes place under conditions of an escalation of the virus, with the R rate over 1 in many areas and with thousands of new infections being recorded weekly. Several cities and towns are already under local lockdowns, with dozens more at risk due to spiraling infections. The government's safety guidelines are anything but. There is nothing safe about the reopening of schools, and the guidelines are farcical and are not grounded in any science whatsoever. Tens of thousands of schools in the United Kingdom, according to the government's propaganda, have performed a miracle. They are supposedly COVID secure and thereby perfectly safe for staff and children to return. They have managed this miracle without having any social distancing, no protective equipment, and the mixing of bubbles in their hundreds. How can any workplace be COVID secure under conditions where this deadly virus is circulating globally and one which has not been contained, let alone in schools which don't have even the minimal safety protections that have been granted for adults? This is a lie and fake news of the tallest order. Only this morning, comments were published in the press by Dr. David Rosser, head of England's NHS Hospital Trust in Birmingham. He reacted to the Sorry, can people hear me?
We can hear you, Tanya, please carry on.
Sorry, I thought there was something being said to me, sorry. This morning, the comments were published in the press by Dr. David Rosser, head of England's biggest NHS Hospital Trust in Birmingham. He reacted to the misinformation being circulated on many fronts that the virus has rescinded and doesn't pose any great threat. He said there is absolutely no scientific evidence that COVID-19 is weaker than it was at the pandemic's peak. He raised that the deaths being witnessed in Birmingham, the UK's second most populated city, equated to the same intensive care mortality rate of 33% seen during the peak of the pandemic in March and to early May. Warning against this complacency, Dr. Rosser said, there's been lots of talk about the increase we see in the community not coming through to the hospital. Well, we are beginning to see that change. We are seeing more people coming into hospital than we have in the last few weeks, and more people in intensive care than we have in the last few weeks. He also challenged rumours repeated almost daily in the mass media and the government officials that the virus has significantly mutated into a less virulent form. He noted that this is not correct and that the medics were deeply concerned about the increase in hospital admissions. Yesterday, the Independent Sage published its briefings on schools, and it stated, schools are like any other workplace and the advice provided by the government is inadequate. We do not understand why social distancing is so important everywhere except schools, and called for high-risk indoor spaces to be closed. None of this will, of course, be acted on. Instead, teachers have been forced to return to work and sent into an utter tailspin over the last week trying to implement the impossible. Every desperate effort to try and keep children and staff apart is compromised before children even enter the school gates. traveling on public transport, coming in with siblings and friends. Bubbles are a pure fantasy, and there is no scientific evidence that it prevents transmission. This is why we have defined the reopening of schools as being safe as a total lie. Scientific studies have established that children transmit the virus and can hold up to 100 times the viral load in their airway tracts than do adults. The school reopenings in the United States and Brazil have already caused thousands of new infections and school closures in many regions. More than 70 French schools had to be closed when their partial reopening in May triggered a wave of infections. Greece had to delay its reopening last week by a further week due to the high rise in levels of infection. The reopening of schools just over the last few days in England alone has seen some 8 schools closed due to infections, several unable to open as children have returned from holidays infected. 3 schools in Bradford, an area which has high rates of COVID and has been in a local lockdown, has been forced to close. And in many other, and across the country nationally, some 100 schools had been forced to close in England since June. In Scotland, Nicola Sturgeon's SNP government reopened schools on August the 11th, and the spikes that have been reported in Glasgow is being fed by the reopening of schools, according to NHS Greater Glasgow and Clyde. The SNP-led Glasgow City Council warned that nearly 200 schools in the city could be shut if the local lockdown measures that have been imposed do not work. Infection rates in the west of Scotland are now higher than in most of England or in countries such as Greece and Portugal, where quarantine measures have been imposed. This is a small indication of what is to come in the weeks ahead. It is true that the vast majority of schools have reopened or will do so in the next few days across England and Wales. And although there is much confusion and some people have bought into the lies that have been spun, this will change, and quite rapidly at that. There is something terrible unfolding. The situation will shift, the confusion will turn into anger, and the committee that is being formed today will guide that anger into a consciously formulated and organised political opposition, and of that we are fully confident. There was nothing inevitable in the reopening of unsafe schools. The outpouring of mass opposition to the deadly herd immunity programme of the Johnson government since March has been dissipated, disoriented and derailed by what passes as the official opposition. This government has hurtled from one calamity after another, totally unchallenged by the labour and trade union bureaucracy. Every U-turn imposed has been the product of initiatives that have come from outside these moribund organisations and from below. The government was forced to shut schools in England from March the 23rd onwards, following an outpouring of opposition from teachers and parents. Collectively, over 1 million parents and teachers signed petitions demanding the closure of schools as the pandemic swept throughout the United Kingdom, in conflict with the Tory government's demands that people had to accept the loss of lives of their loved ones. The unions did nothing to pull out their members and force the closure of schools. The government has tried to prematurely reopen schools from June the 1st, in line with the back to work agenda and the lifting of the lockdown measures more broadly. This was a disaster for the government, as hundreds of thousands of parents refused to risk the lives of their children or communities during the pandemic, leaving many schools deserted and shut. The unions again called for only an extension of 2 weeks to June the 15th to give schools more time for preparation. For them, the issue was one of logistics, not risks. They have fully supported and welcomed the reopening of schools in September, although none of the 5 tests for the safe reopening of schools set by the unions have been met. These demands have now been shelved, with the unions merely asking for a Plan B to be drawn up for the inevitable COVID-19 outbreaks which will follow. The government delivered its Plan B on the last day of the school holidays. Schools will revert to part-time learning and remote learning in the events of high rates of infection, and children can now wear masks in corridors when moving to different lessons and only in areas of high infection. Job done as far as the unions are concerned. They are now fraudulently claiming to be defending parents who risk being fined for refusing to send their children to school. It was parents who initiated a petition which gained some 108,000 signatures demanding the rescinding of this punitive action. The unions called only for leniency and case-by-case reviews. Many thousands of families have taken desperate measures to protect their children, including deregistering them from school with the risk of losing a place in the long term. As one parent who reacted to Boris Johnson's demand that parents had a moral duty to send their children back to school stated, "How dare you lecture me? My moral duty as a parent is to protect my child from a risk which your government is incapable of doing." The petition, which was organised by the parent group, Boycott the Return to Unsafe Schools, who is calling also for a parent strike, were advised by the National Education Union when they approached them for support to remove the word boycott from their name. An email was sent to teachers only yesterday by the National Education Union offering advice to its members who have returned to work. Now, for those who are not in education, I can only describe the past few days as the week from hell. And this sentiment is shared by many. The level of stress and exhaustion is quite overwhelming. This is all conscious. You're isolated and unable to meet with colleagues and offload. You learn to grow eyes at the back of your head trying to keep things safe, but you know the children in your care are not safe. Your colleagues are not safe. Their families are not safe. You are physically and mentally drained, yet you try and stay positive and happy for the sake of the children. So what message has been sent to support the staff in this situation by the NEU, the largest education in Europe, which they constantly remind us of? Their words of consolement were, "We want you to know that your union is here for you. We have your back. Wishing you all the best for the term ahead." A banal, perfunctory, and utterly contemptuous memo from the safety of their comfortable offices. Their role as accomplices to an unforgivable crime has not been lost on their membership, however. Members feel that they have been stabbed in the back, more like it. In a survey conducted 2 weeks ago by the SEP on the sentiments of educators and parents on the reopening of school, the majority of participants were contemptuous of the union's collaboration with the Tories and denounced them as appalling, spineless, shambolic, scandalous, disgraceful, disgusting, and pathetic. Now, the SEP is the only organisation that is calling for the mobilisation of mass class action to prevent the deadly reopening of schools. There is no other meeting like this. From day one, we have systematically and consistently fought to alert workers to the dangers and mobilise their independent strength against the subordination of the health of workers to the wealth of the ruling class. In the UK, we published a statement calling on the necessity to form rank and file safety committees across the country in line with our initiatives internationally. We've published hundreds of articles and several statements providing a clear programme and perspective for educators and the working class as a whole. The aims and policies of the Education Rank and File Safety Committees are clear. We demand the closure of all schools until the virus is eradicated. In this aim, we will fight for the organisation of a general strike as the only means for this perspective to be achieved. We clearly state that where schools are forced to open, we insist that the rank and file staff in the workplace must, through the safety committee, which has been formed, determine what is safe practice and what is not. The education of children is important and necessary, and to achieve this, we demand full funding for public education and online instruction, for a massive expansion of testing and contact tracing, for free speech and the protection of whistleblowers, the rescinding of the threat of fines for parents who refuse to send their children to unsafe school, and for full income protection to all parents and carers who stay at home with their children. The catastrophic impact of the pandemic is fundamentally a social and political issue and not simply a medical one. The technology and medical expertise exists to contain the virus, but under capitalism, everything is subordinated to the profit interests of the corporate and financial elite. The demands advanced by the SEP are not based on what the corporations and politicians claim is affordable, but what is necessary to protect the lives and well-being of children, teachers, educators, and the entire working class. We want to encourage this afternoon the broadest based discussion on these measures. I call on all of you to actively participate in this discussion, share your experiences and questions, to join the committee and to build it in your workplace and community. This is an urgent task, and I thank you for your attention.
Thank you very much, Tanya. And if our listeners do have any questions for Tanya, feel free to enter them now in the questions panel, as indicated earlier, and we will get to them shortly. I'll also take this moment to encourage our listeners, if they've not done so already, to sign up to the Educators newsletter. Now, this is the first step to building the necessary opposition and political organisation among school workers. Its role is to inform educators, to counter the relentless government propaganda over the return to school, to connect them across the country and internationally, and in doing so, to facilitate the building of a network of rank and file safety committees. So I urge you again to sign up now if you've not, and if you have, to sign up your friends, colleagues, and participate in building as large a base as possible for this initiative. Now, our next speaker is Dr. Benjamin Mateus from the United States. Dr. Mateus has written extensively on the COVID-19 pandemic and recently published a significant two-part article titled "The Pseudoscience Behind the Right-Wing Drive to Force Schools to Open." He has presented on this topic for the Educators Rank and File Committee in the United States, and we're very pleased to have him do the same for us today. Welcome, Dr. Mateus.
Good afternoon, and thank you for allowing me to participate in this very important meeting. Richard, if you can go to the next slide. So the conditions that exist in the UK is very similar to the issues that are developing very rapidly in the United States. The frustrations, the anger, the social tensions that are arising amongst teachers, parents, and the communities and the working class in the United States is shared with the UK families and teachers, and it's an international issue. When this pandemic first reared its head and began to spread very quickly, despite the World Health Organization stating that this is a global emergency, there was no serious effort on the parts of the various nations to attempt to put into effort a marshalling of all the medical facilities, building a cadre of contact tracers, using the available technology to begin ramping up of testing and driving the economy in a direction to contain this pandemic very quickly. Instead, once the pandemic began to run rampant quickly and the impact was seen, it went into a massive lockdown, impacting the economy. And it became very clear and abundantly clear to them that this disease was worse than the cure. And in short order, the policy of herd immunity became the primary policy to get through this pandemic as soon as possible, so that the economy can get back to normal, essentially placing the markets above the lives of the population at large. So it's important to understand what herd immunity is. It's the resistance to the spread of a contagious disease within a population. So you have enough people who have developed immunity to a contagion that those who are still naive, are unvaccinated, are safe. And this usually applies to a process where the population is vaccinated against, for instance, the measles. Explicit or implicit, it's the operating policy of the ruling classes that places the interest of the profit above that of the lives. And though we have the means to contain this pandemic, the impact on the economy prevents them from using all these resources to save lives and save the population at large. Next slide, please. I think Dr. Mike Ryan, the executive director of the WHO Health Emergencies Program, said it best, and I will quote him. I think what we can say with certainty is right now, as a planet, as a global population, we are nowhere close to the levels of immunity required to stop this disease transmitting. And we need to focus on what we can actually do now to suppress transmission and not live in the hope of herd immunity being our salvation. Right now, that is not the solution. What he's saying here is, despite the catastrophic events that have taken place in Europe and the United States and in South America. At best, only very few nations have even approached 10% or exceeding 10% of the population having developed antibodies. This means that in order to achieve herd immunity, the whole population of a country, of a continent, of the planet needs to approach close to 65 to 70%, which is probably the more correct answer. And that means we would have to go through this 5 to 10 folds more before the population achieves herd immunity. And we're talking about another year or a year and a half of intense community transmission before we even achieve that. Next slide, please. This Sweden was the poster child of herd immunity. One of their lead national epidemiologists championed the policy of herd immunity, and it was essentially absorbed into every other political policy that existed at the time. And this is in late March and April. And everyone, put Sweden on the pedestal as the middle road to take. And this graph shows what happened in Sweden when we compare the per capita death attributed to COVID-19. We see that very early on, as Sweden implemented their kind of casual approach to the pandemic, they continued in their trajectory, whereas even though the United States went into a lockdown, not necessarily a complete lockdown in many states, we can see the benefit the United States had in comparison to Sweden, which highlights the deadly aspect of a policy of herd immunity. Next slide, please. Stat news, I think sometimes the bourgeois press and various news press get it right, whether they intend to or not. And this quote is worth repeating. The Swedish approach was to largely allow businesses, and underscore businesses, to remain open. And at first it seemed to work with a death count nowhere near what it was in countries such as Italy, Spain, and the UK. But even as Sweden was being hailed as a model, its cases were steadily rising, and its death rate now exceeds the US. Sweden also did not seem to stave off the economic damage it was aiming to avoid. I think it highlights the fact that the economies of all nations are intricately tied, and if we're going to get through this pandemic, it has to be on an international perspective, such as the one that the SAP is launching with the teachers in its growing movement to incorporate other workers and parents and communities into protecting lives over the riches of Wall Street. Next slide, please. I wanted to compare the UK and the United States in some of these slides for some of the audiences to understand what was happening. When we look at just number of cases, the United States appears to be massively in advance of everyone else. What we see on the left panel is the cases, and on the right panel, the deaths. Everyone had an initial surge in number of cases, and the lockdown began to turn. That's where we see the peaks of cases downturning early in March and April, or this would be day 50. And as did the deaths, they all peaked and began to downturn, staggered by a few weeks from the time of the COVID detection. Next slide, please. When we look at the per capita basis, we see that the initial surge in the first month was not dissimilar between the two countries. Essentially, there were no measures in place, and with COVID-19 having being infected and then having a period of time up to a week to 2 weeks before symptoms appear, the infection occurred a week to 2 weeks prior to the testing and confirmation. So you have to almost push these curves to the left a week or two. And what we see here is that during the initial period, the UK and the United States were very similar. But what happened in the United States was leading the pack in this regard. There was a push to begin quickly opening the country. Now, the peak in the United States was predominantly in New York, and specifically the epicenter in New York City. So other states were running under the radar, essentially, because everyone was focused on New York. When we separate New York from the rest of the United States, we see that the pandemic was actually not accelerating per se, but continuing to rise, but hidden under the graph created by New York. So that's why you see this plateau of 20,000 between days 50 and 100. But this was at the end or mid-July, May, June, and then by mid-July, we started seeing cases beginning to rise across the Sun Belt. So we saw in Florida, Arizona, Texas, and California, rapid rise in cases. And if you look on the graph to the right where the deaths are, we see also the deaths had nadired and began to peak again at day 140 as a result of the opening of the commerce. Next slide, please. This shows the case fatality rate between the two countries. This is a crude measure of number of people that are infected, and it's affected by multiple variables. So it's not a clear indication as to what actually is happening. To compare the United States and the United Kingdom in this regard would be unfair, but it gives you a highlight of a number of people that are affected. And I would argue that it's most likely related to the age of the population and the ability of the healthcare system to manage patients and how those policies are directed. Next slide, please. What happened in late July, it was President Trump essentially ordered the CDC to stop reporting hospitalization and gave that to another agency. And we also noted that the number of testings being done were suddenly dropping. I believe that there was behind this FEMA and certain proprietary rules that allowed only purchasing of certain reagents for testing to be done by certain companies. However, due to the lag in reporting numbers, due to various factors, the number of testings that we were doing were starting to drop in the United States. And with that also dropped the number of cases. And many surmised that this was willful, and I agree, it was willful. This was the time when school openings were being discussed and the need to get teachers and students back in class. And the number of testing declining at this time is not necessarily just a coincidence. The UK did ramp up its testing, and in comparison, the United Kingdom's positivity rate is much lower. And positivity rate means the number of people you test before you detect one. The lower it is, means that you are testing more before you find one. And that's a good thing, because countries in which the testing is high save lives. Next slide, please. So getting back to the discussion topic, these are some lies that are being spread in order to get teachers back to school. And some of the questions are: children are less susceptible to infection and don't develop serious symptoms from COVID-19. We'll discuss that briefly. Children rarely transmit COVID-19, and schools can be reopened safely. And as the speaker before succinctly expressed, every one of these is a lie. Schools cannot be reopened safely because of the nature of the virus and the proximity and social distancing and the inability to mask. Children do transmit, and serious symptoms can be developed by children, though as not to the level of adults. It is not a children versus adolescents versus adults versus elderly. We are a community, we all live together, and this affects everyone. Next slide, please. So the data on children was limited, essentially, and the American Academy of Pediatrics were the ones who actually began putting out some data recently that began to track children's infection rates. So what happened in March, what saved lives in March, was that schools were closed. That was one of the first actions taken approximately over a 10-day period when schools closed in the United States. 95 million daycare centers, school K through 12 schools, universities were shut down, and children were sent home before they were infected. That led to approximately a twofold rise or savings in death, from 45 to about 88,000 deaths in April. and a threefold rise in infections that were saved. That was a byproduct of just closing the schools. And so the children weren't infected because they were home, and there was no data on them that was reportable. And so people just assumed that children couldn't be infected. Yet we know that measles, polio, tuberculosis are all diseases that are airborne and can be transmitted by children. We know that SARS-CoV-1 and MERS are airborne and can be transmitted by children. So the assumption that somehow that SARS-CoV-2 cannot go airborne or cannot be transmitted by children was essentially a fallacy, and mea culpa, I guess. We should have assumed that the children were a vector before proving it otherwise. So this graph essentially shows that over the period of time when the economy began to open, children became a larger component of the overall percent in the population, and it's currently at 9.5. So the trail off there is actually now on trajectory. Next slide, please. So the New York Times finally, just a week ago, posted this article, and I pulled these graphs from them, and where they show the number of cases rising compared to everybody, hospitalizations and deaths. And in every instance, what we're seeing here is not only are children almost 3 to 4-fold times increase in number of cases in hospitalizations, also in deaths. And this must be taken seriously. Next slide, please. This is a study that was done by the Lancet and published in the Lancet by the UK College. This was a modeling that was done, and what the authors were looking at was if schools were to open, under what conditions would they need to open schools to prevent the transmission in the community. At the very top graph, what they're seeing is that if the testing is low and the contact tracing is marginal, by December, you're going to see a peak that's 2 to 3 times higher than it was before. Only through extensive testing and contact tracing can you prevent this from occurring. And as we said, we need a broad cadre of contact tracers and testing capacity to contain this virus. But what is key here also is that the transmission rate is extremely low before you begin this process. That means that you're able to identify where the virus is, who has it, and stop clusters immediately. But this requires also not just testing, but rapid turnaround and action on those testings. Next slide, please. It's critical, again, to address how this virus is passed from people to people. Up to now, people have been arguing that it's passed through contamination, through surface contamination, and or what they call respiratory droplets. But this community of physicians and scientists and physicists appeal to the World Health Organization that COVID-19 is passed through respiratory or aerosolization, or basically what that means is that these are respiratory droplets that are so small they can linger in the air for minutes to hours, and they can be passed across long distances, the whole room in essence. And rooms that are poorly ventilated are a breeding ground for transmission. And we know this through seeing people in restaurants get COVID-19. We see it in churches in South Korea. We see it in chorus rehearsals in the United States, where essentially everybody who was singing became ill with the virus. Next slide, please. And these diagrams just essentially highlight the nature of what a respiratory droplet is and what a aerosolized or airborne droplets are. Next slide, please. And this cartoon again demonstrates how when a person coughs, sneezes, sings, speaks, these respiratory droplets will go airborne. And those that are heavy will drop, but even if you are far away, these will linger in the air and essentially will be inhaled. And a study in Florida essentially confirmed that when a patient with COVID-19 who was symptomatic was brought to the their room, they began collecting droplets 7 feet away, 16 feet away, and they cultured those droplets, and there was live virus in those droplets, which confirmed essentially as a proof that was necessary to document that aerosolization does occur. Next slide, please. In this slide, I just intended to, we should have more discussion on this, but in the United States, 1.5 million teachers, or 1 in 4, are at greater risk of serious illness if infected with coronavirus. That means if they become infected, they're at the risk for having significant morbidity and mortality with this. And additionally, many of these children who are going to school also live in multi-generational families where they have elderlies that live at home with them. As the speaker before said, this is a poor man's disease. This is a working man's disease. And the oligarchs have no intention of attempting to stop this virus because it affects their bottom dollar. Next slide, please. Where we are now, and this is a critical point, and why this meeting is necessary. It's not just about schools. It's truly a international issue. The IHME's predictions. This is the International Health Medical Evaluation at the University of Washington. Just reported that they predict for the globe by January 1 that there will be a massive loss of life that will begin to occur. They expect that a total of 2.8 million will succumb to the infection, or 1.9 million more from now until the end of the year. Daily deaths could reach as high as 30,000 per day. They write, the increase is due in part to a likely seasonal rise in COVID-19 cases in the Northern Hemisphere. To date, COVID-19 has followed seasonal patterns similar to pneumonia, and if the correlation continues to hold, northern countries can anticipate more cases in the late fall and winter months, which means the United States, Europe, and the UK will be in line for this massive increase in infections and deaths. So this is a critical warning, and I think it requires intense discussion about the tasks before us. Thank you so much.
Thank you very much, Dr. Mateus. Our next speaker is Sue Phillips, a primary school teacher in Melbourne, Australia, which is now providing a terrible proof of how quickly the virus can spread out of control. Sue is also a member of the Committee for Public Education in Australia, and she's reaching across a huge time difference to be with us today. So a very warm welcome to you, Sue.
Thanks, Thomas. Thank you very much for the opportunity to participate in this call-in meeting. The Committee for Public Education in Australia is made up of teachers, education support staff, students and academics, and we wish to send our warmest greetings to all those that are attending the meeting today. Without the independent intervention of educators and workers internationally, taking matters into our own hands, the working class faces an historic catastrophe. We applaud the decision of the Socialist Equality Party of Britain to establish the Educators Rank and File Committee to prepare a national general strike, a perspective now being taken forward by teachers and students in the US, Germany and France. 2 weeks ago, I had the opportunity to attend the first call-in meeting in the United States of the Educators for Rank and File Safety Committees. Teachers there spoke about the shocking conditions in schools and universities, being forced back to school knowing that schools are unsafe, putting their lives and their students' lives on the line, where educators are regarded as no more than childminders, totally expendable in order to open up the economy for profit. And as all of you are aware from the UK, this is the exact same situation in Britain that Tanya has powerfully described. Teachers across the US spoke strongly at that meeting, expressing their opinions and voicing their concerns. something that the unions, media and the education departments totally oppose and are utterly terrified of. For decades, our voices have been systematically suppressed. We've been gagged for years, supported and policed by the unions. This is now coming to an end, with teachers and other sections of workers, such as the auto workers in the United States, organising outside the unions, forming rank and file safety committees, expressing the growing combativity and the upsurge of the international working class. That's why I very much agree with one of the demands outlined in the SEP UK statement. It reads, for free speech and the protection of whistleblowers, all those who speak out against unsafe working conditions in schools, factories, warehouses, hospitals or offices must be defended against any victimisation by employers or state officials. All workers who have been victimised must be rehired with back pay. The demand for free speech and democratic rights is critical in the midst of the pandemic, but our voices need to be heard in every and all aspects of education. We have the right and must speak out, exposing the appalling conditions in the schools, the lack of resources and inadequate staffing, the deepening budget cuts, and the retrogressive curriculum systematically imposed and embedded by edgy business at every level of the education system. No matter what country we live in or whether the government be Republican, Tory, Democrat, Liberal or Labor, educators are faced with the same homicidal policies. Despite international experiences in the US, Israel, Chile, France, UK and Australia that have revealed the reckless reopening of schools leads immediately to COVID-19 outbreaks and deaths, governments are proceeding at breakneck speed. This week, Tony Abbott, a former Australian Prime Minister speaking at the London Policy Exchange think tank, spelled out the callous and brutal agenda of all governments internationally. He described governments that were carrying out lockdown measures to stop the spread of COVID as, quote, health dictatorships. In other words, putting the health, the lives of people before profit equates in his mind to a dictatorship. He said the economic cost of lockdowns meant families should be allowed to consider, quote, letting elderly relatives with the coronavirus die by letting nature take its course, end of quote. Calculating the financial costs, he claimed it was costing the Australian government as much as $200,000 or £1,100,000 to give an elderly person an extra year's life, substantially beyond what governments would usually pay for life-saving drugs. He said not enough politicians were, quote, thinking like health economists trained to pose uncomfortable questions about the level of deaths we might have to live with. Now, of course, Johnson would have no differences with Abbott. Abbott's statements reveal the stark reality of life under capitalism. This is the class policy of the ruling elite that underpins all aspects of government's response to the pandemic. The death of tens of thousands of working people, the poorest, the most vulnerable, for the financial elite, this is a non-issue. So long as their own wealth and profits are secured. The elderly who no longer create profit can be eliminated, be left to die alone in underfunded and understaffed nursing homes. Such an agenda can only be described as barbaric. Australia, while regarded as some sort of exception to the pandemic, has, however, followed a similar course to that in other countries. The Committee for Public Education from the beginning of the pandemic has called for the formation of rank and file safety committees fighting for school closures and against their rushed reopenings. We published our first statement on March the 18th. This was in the midst of growing teacher opposition in Australia, in the UK, in New York, and opposition of auto workers in America and in Italy. That same day, teachers at Footscray High School, a secondary school in Melbourne, voted to establish a safety action committee independent of the unions, the government, and the school administrations. Like our comrades internationally, we have fought to expose a campaign of government misinformation, pseudoscience, emotional blackmail, threats, and out-and-out bullying and intimidation by governments. Complicit in the Australian government's murderous campaign to open schools has been the teacher unions. Not a word of opposition has been heard from the unions in 6 months, endorsing every government dictate. Acting in partnership with government officials, they have consciously covered up the extent of the dangers and the number of COVID outbreaks in schools, desperate to divide and dissipate growing teacher and parent opposition. In just over 8 hours' time here in Melbourne, the Andrews State Labor government will be announcing what it has been titled the road map back to open up the economy. This agenda has been worked out behind closed doors with the main business leaders representing 10 leading industrial groups. Over the last 2 months in Melbourne, Melbourne has become the epicentre of COVID-19 outbreaks and deaths in Australia, with a second wave of COVID-19 infections. For the last 6 weeks, Melbourne has been in 4-stage lockdown. This includes overnight curfews, closure of retail, cafes, hotels and restaurants, mandatory mask wearing, and schools teaching online. All right. The lockdown is the outcome of the negligent policies of both the state and federal government and the unions who oversaw the premature of the opening of the economy, spearheaded by school openings and face-to-face teaching. In April, the PM announced that social distancing was not appropriate or required in schools. In May, governments began lifting restrictions. In June, infections began to increase and nothing was done. In early July, there were 20 people that had died. Now there are well over 650, with more than 500 dying in aged care facilities. Last week, Meredith Peace, the president of the state branch of the Australian Education Union, made clear once again the union's complicit support for a return to face-to-face teaching. This followed the Education Minister flagging a reopening of the schools in Term 4 beginning in October. Meredith Peace, speaking at a regional meeting of Melbourne teachers last week, admitted that teacher union officials had been holding weekly meetings with senior education department officials during the lockdown, and that if the government recommended the reopening of schools, the union was in favour of a staggered return, which she claimed had proven effective in the past. Effective? What a total fraud. So effective was the last staggered return to face-to-face teaching at the end of June that it led to more than 70 schools forced to close in just 3 weeks, and in some cases, schools closed several times, with hundreds and hundreds of teachers and students testing positive. When the union president was asked why she could make such an extraordinary statement under conditions where a school cluster had developed at Al Taqwa College involving more than 200 teachers and students testing positive, and when the chief medical officer had admitted that there had been worrying evidence of student-to-student transmission and teacher transmission, she said in reply, quote, "I'm not going to get into discussing Al Taqwa. Al Taqwa is not one of our schools." What she meant, but didn't really elaborate on, was that the teachers at Al Taqwa belong to a different teacher union. They don't pay membership dues to her union, so the teachers there were of no material or financial interest whatsoever. What happened to teachers at Al Taqwa was irrelevant. Further exposing the bankruptcy of the union, she went on to stress several times to questions asking why teachers were sent back to face-to-face teaching under unsafe conditions. She stated, quote, "Sorry, we don't run the government. We don't make the decisions. We don't get the opportunity to agree or disagree with the chief medical officer." So if the unions can't oppose or even question the decisions of governments, don't get the opportunity to agree or disagree, then what is exactly the point of the unions, except to straitjacket teachers in outdated organisations that are not only useless in defending the safety of teachers, but have shown they are opposed to doing so. What was exposed in that meeting is not some aberration, but applies to the unions internationally. The unions have shown they are not defence organisations of the working class, but the industrial policemen of the ruling elite who have no independence from the governments, employers and the capitalist state. Their aim is to defend their own material interests and privileges, to sit at the table alongside the ruling elite, and it should be emphasised that there is no line they will not cross to do that. Teachers in the UK and internationally can't sit back and wait on events, or nor can we place one iota of trust on the unions. What is at stake are life and death questions. The recent UK survey of parents and teachers carried out by the SEP shows that there is growing support for a national strike. This survey must, however, be acted on. Steps need to be taken out of this meeting for the formation of independent rank and file committees following the lead of educators in the United States, Germany and Australia. Whether educators are working online or not, this must be carried out now. As the perspective of the World Socialist website stressed yesterday, quote, "The global campaign of the ruling elite to open schools must be answered by the global action of the working class, building networks of rank and file safety committees in every country to mobilise the collective strength of the working class as an independent international social force." In that historic struggle, the Committee for Public Education stands with our comrades in the UK and all educators across the globe. Thank you.
Thank you very much, Sue. I think the last two contributions really underline, quite obviously, the international character of this struggle, and again, therefore, the importance of the Educators newsletter. Workers have a lot to learn from the experiences of events in other countries, and have a lot of strength to be gained from a global unification of their campaigns, a necessary one. The link to sign up should be on your screens now. Now, these have been hugely important and really detailed contributions. So I'd like to open it up now for any initial questions or comments from our audience, and we can continue with our prepared speakers after that discussion. Just to repeat the instructions from earlier, you can ask a question, type in a question using the questions panel on the right-hand side of your screen. That will be sent to me. I'll relay it to our speakers. You can also raise your hand if you'd like to speak, ask a question verbally, or make a contribution yourself. I know it can be, feel free to do that now. I know it can be intimidating to speak, almost especially in an online forum and following extended prepared remarks, but really your contributions and participation is the heart of what this meeting is all about. This is your forum. I can see that we have at least one hand raised person wanting to speak at the moment. That's Alison. So if the organizer could unmute Alison. Alison, you also have to unmute yourself. I'll let you know when we can hear you. Do we have Alison unmuted?
Oh, there I am. Hi, everybody.
Excellent.
Greetings.
We can hear you.
Thank you. Thank you, Tom. I'm Alison, and I'm in Italy, and I have some remarks that I would like to share at today's meeting. In Italy, as in nations around the world, the news media and government, with the support of the trade unions, are relentlessly marketing the right for children to have a quality in-person education, the human right to go back to school. But exposing this lie, Franco Locatelli, president of Italy's Higher Health Council and a member of the government's Technical Scientific Committee, said, "We will reopen the schools at any cost." Even as COVID cases are exploding in Italy again, it's back to work and back to school. The Ministry of Education plans only limited isolation for students and teachers who get COVID. There is no universal COVID testing, no meaningful contact tracing, and no universal safety protocols. The government promised masks for teachers and COVID testing at the beginning of the academic year, also for teachers. But the protective gear isn't arriving on time, and the testing protocols are different in every region. For teachers at my school, if their primary doctor did not agree to write a prescription to get the test, then they have to pay for a private test. Each region is different, but the pandemic is the same across Italy. The Ministry of Education published a list of the new safety protocols for schools in this past August, which Education Minister Lucia Azzolina promised will protect the health of students and teachers and improve education in the long term, including bringing an end to overcrowded chicken coop classes. However, these overcrowded schools are not getting an overhaul before the opening of the school year. So how long term is long term? It's just talk. Teachers' unions agreed to all of the government's proposals, meaning that schools can begin applying them before the new term starts on September 14th. But many regions are starved for cash. How will they implement safety protocols without cash and without adequate space? The government is leaving implementation of the protocols to the discretion of each head teacher. And it certainly, the protocols certainly don't answer all of the questions that teachers and parents have about going back to school after more than 6 months of school closures. For example, there's no mandate that kids have to get tested before returning to school. And there's no mandate for masks for all ages. Additionally, in city centers, many children take overcrowded public transport to get to school. How is this safe? My neighbor is an administrator at a local public high school. There are 6 workers in her office, all less than 1 meter apart from one another. Her head of school is demanding that all 6 return to school and that they work every single day in a closed space, elbow to elbow. Despite the government protocols that workers remain at least 1 meter apart and do smart working wherever possible. My neighbor and her colleagues had to buy their own masks because the government issued masks hadn't arrived at her school when she was called back to work. Infections are increasing across Italy. Minister Locatelli said, "The infections are increasing, but we can contain the epidemic." But the epidemic is not being contained. It is being allowed to spread by forcing us all back to work and back to school. By opening up the economy, the pandemic is getting out of control once again. At my school, we had to sign a waiver saying we won't engage in risky behavior, such as taking public transport. For those of us who don't drive, that's really difficult. We also had to agree to come back to work during a pandemic and not hold the school liable for any COVID-related illnesses or deaths. Basically, we're signing away our right to a safe working environment. One of the local high schools here has already closed down, noting 60 COVID infections of students and staff on campus. The science is clear. Stay home, test everyone, contact trace widely and isolate, but the politics contradict that advice. I share the experience in Italy as a way of underscoring that the pandemic is global. Capitalism is global. And so the response by the working class must be globally united. And this meeting is a great place to start. Thank you very much.
Thank you very much. Alison, the story of the waiver you've been asked to sign, there could not be a starker indication of the threat that is being posed to millions and millions of people and of the way it's being treated as part of some sort of economic cost benefit analysis by the ruling class. Just to emphasize, obviously you've detailed the situation in Italy, to emphasize again the international dimensions of this. We've had a write-in comment from a participant who says that in Greece, children are to be sent back to school with their class size limit set at 25. Their only protections are free bottles of water and masks handed out by the Education Ministry to supposedly prevent cross-contamination. We have also had a question written in, which I think will help some of our panelists get to the political response that we're arguing for and where we see the basis for an opposition struggle to make schools safe. So I'll put that to our panelists now. Perhaps Tanya could make a first answer at this. Nigel asks, should we be pushing to encourage our local councils to accept their responsibility for all schools in an area, even if educational jurisdiction of some is now in the hands of trusts? Tanya, would you like to go where you were with that question?
Hi, thanks Nigel for your question. I think this has become quite an important issue throughout the pandemic, and one that's been sort of debated and discussed. I mean, in the first instances, one element of it is that the national government has certainly offloaded a tremendous amount of its responsibilities, both financially and in every way possible, to the councils who have attempted to implement these safety guideline measures. But the other political element of it is that the unions certainly have really had a major campaign to claim that really the opposition against the eruption of COVID and the return to schools and so on and so forth had to be led through the councils, and nominally the Labour councils themselves. I mean, you say that should they be responsible for all schools rather than just state schools, which is a reference to the fact that certainly the majority of secondary schools are now academies, and a significant proportion of the primary schools are academies, which none of which has been opposed throughout the unions or the Labour councils themselves. But the issue is what role are they playing in the protection of schools that are under local authority control? In any instance, they've taken zero measures that do not challenge the guidelines that have been granted by the Tory government itself, nothing at all. There's no divergence on the policies. There's no attempt to mobilise anything, and I think it is very much, like I said, it's been pushed to a great extent because there's been some notion that the Labour-led authorities in the working class areas, if given more powers, etc., will be able to somehow provide a different path, a different perspective, and this is not at all the case. I know, for example, the union in Sheffield, for example, the National Education Union, has been taking up a legal challenge in relationship to the local authorities on the grounds that the reopening of schools is perhaps in conflict with Section 44 and so on, rather than taking up a national campaign. But we've heard nothing more about this, so we don't believe that a turn to the Labour officials is the solution. And one, you know, I didn't have the opportunity to go through what Starmer and the leader of the Labour Party have said on this in the first instance, who have just fully welcomed it and said that schools had to open, no ifs, no buts, no equivocations. But what has also been revealed, and we've highlighted this in the WSWS, is the response of Jeremy Corbyn himself. You know, it was revealed that Corbyn had participated in discussions with Boris Johnson throughout the early stages of the pandemic, in which the policy of herd immunity was discussed and was going to be implemented, and did nothing to alert broad sections of workers. So our position is that the opposition that does exist amongst teachers and staff cannot and must not be subordinated to the official political structures, which includes the local authorities, which are run by the Labour Party and whole sections of the trade union bureaucracy, but in an independent struggle in conflict against them and the agendas that they have been implemented and are imposing in local authority after local authority. So that's how I would respond to that.
Thank you, Tanya. We also have a hand raised by Tom P in the chat. If you'd like to make a contribution now, I'll ask the organizer to unmute you. You also have to unmute yourself, and I'll let you know when you can be heard.
Hi, yeah, I just want to say just how important this meeting is, and just the actual international nature of the meeting has been fantastic, and what's been covered so far. I'm a secondary teacher, secondary school teacher in a school in the UK, in England, and like Tanya said in the first opening report, it's been a couple. I haven't had all the children back yet in our school. It's just been horrific in terms of the actual couple of days of actually organising and getting ready to start welcoming the kids back on Monday. I think it's over the past 6 months, it's been astounding what's happened in terms of in schools, in my experience as well. Our head teacher has been completely supportive of the staff, but this has been under conditions where the situation has been not more easy, but actually something that has been able to manage in some respects when the schools were open for key workers. We had a rota system, and we were in the bubbles then were actually in a maximum of 15 children, and we had very small amounts of children who actually came in as key workers in my school. But even then, it was clear that social distancing was impossible in the school, and this is something that has to happen in terms to reduce the actual cases. Then obviously you've had the government with the full support of the Labour Party and the unions have now put staff, and I've always done this, but they've put staff and children in jeopardy. Teachers have had to change their plans without any extra funding. We have this situation in the UK and internationally as well, where school funding has just dropped in real terms over the course of the last decade. And in order to actually pay even their staff and keep staff on, and you've had redundancies and voluntary redundancies across the UK in terms of cutting staff and cutting TLRs, which are in the UK, they're sort of like payments for responsibility, to try and put more hours in for people because of the lack of funding. But yet you have thousands of pounds spent on these superficial measures by schools, signage, hand sanitizer, and there's no money for it. There's no money being given to the schools, so there's complete disregard for any sort of safety for the children of our schools. These millions of schools that are going back this week have been back already. There's money for big business, of course, and money for war and the military, but none to make schools safe. And this is the nature of the capitalist system we live in. I think the government guidance, is allowed children to be, in whole group bubbles in secondary school. It's farcical. It's a total measure. And as Tanya said in the open report, these kids are actually, they're coming in packed buses, full buses. They don't even have to be separated on the buses or social distance on the buses, as long as they're wearing a mask. But these are the full up, and that's compared to public transport, it's completely different. It's a total measure, and we said, and at my school we have year groups of up to 250 children, and adding the parents and carers on top of that, and it's thousands of people being put at risk bringing them back to school this time. I've been looking on as well on Facebook and social media as well, and I've heard that some schools, our school allowed us to wear masks in between, even though we're not in a high infection area of the country. But I've heard that some schools aren't even allowing this. You've got, there's I've seen stories already of other teachers saying that they are stressed, they are feeling not safe as they move between corridors. What we are having to do, and most teachers are having to do in the country, is actually move ourselves between zones. So schools have actually created zones, which means that, for example, a year 7 child, like a 12, 11-year-old child, is in one area of the school, and then year 11, for example, who are doing GCSE, year 16-year-olds are actually never in the school, and you have to move between those areas as a teacher. You don't have your own classroom, you have to move. We've been bought trolleys, which is it's not even an issue in some respects to carry our stuff around, and the kids are staying in those zones and moving within classrooms, within the corridors. But ultimately, that the stress level that raises in teachers having to go around to move around and never be in the same place, to completely move, and it's completely just untenable. A colleague I was talking to was saying that are there going to be teachers left in teaching by Christmas if this continues in this respect in terms of these conditions? And I think that I haven't slept since I've been back, and I haven't in the kids back yet. The last 2 nights I've really struggled to sleep. My brain has just been fully on worry and about the actual term ahead. And this is the same as I'm seeing across in terms of speaking to other colleagues and also seeing on Facebook as well. And we have for example, we talked about the class sizes, the bubbles, 15 children. We have class sizes of 32 children, some schools even more, and they're being packed into classrooms with no social distancing at all. And the advice is to have rows in the classroom, but this obviously to try and avoid transmission in some way between the children. But ultimately, this makes some classrooms smaller, because there are some really small classrooms in schools, and it packs them together like sardines. And I saw a school share photos of the first couple of days back online, and to say welcome back to the kids. Nothing untoward in some of the pictures, but when parents started to see those pictures, there was outcry. There was literally, people were absolutely shocked by the fact that their children, as it was their children in that picture, were packed in. There was even examples of an assembly, a whole group in an assembly, which I was not sure was supposed to happen. But schools are doing things differently. There's no one size fits all, and that's the idea. It's been literally given over to schools and local authorities to do it on their own. There's like sort of washing the hands of responsibility. Here's the guidance. You do what you like. And I think one of the things that happened as well, some of the pictures were taken down after the backlash from the parents. So there is literally a sort of like keeping the actual information, which is why the demand of transparency and information coming forward is so important here, that people need to be informed about what's actually happening. And I think I was going to raise this as well, but Tanya talked about, the first speaker talked about the NEU sent out an email on Friday, we've got your back. And I was appalled by it. They've allowed this situation to happen. None of the 5 tests, as you said, have been met over the past months, and they've dropped their demands. Same time, every single time they call for the government to work with them, and happily to impose this. They had nearly 500,000, the NEU, the National Education Union, they did a survey in the initial lockdown, and they had nearly 500,000 of their members supported the campaign against reopening schools, but they've done nothing with that support. Nothing. They've allowed people just to be pushed back into the schools, and even the guidance, that new guidance. I mean, the thing that's actually been put forward by the unions to say it's our victory, for example, the fact the guidance for the blended learning idea in terms of that when there's a spike in infections. It was released Friday night before a bank holiday weekend. The months has been available to the DfE to actually organise this, the Department of Education to organise this, and the government, and the debacle of A levels and the GCSE results. It just shows that the class nature of what's happening, the fact that they don't care about the kids in the schools. They really don't, and they happily put these people back, teachers back, into this situation, without any sort of thought about the safety of the whole community and teachers at large. The Independent Sage, for example, has said that schools should be treated as any other workplace, and that the government guidance is inadequate. And this was this week, and it boils down to the profit before lives. this is always, education is sorely needs an injection of funding, and the SEP is obviously calling for that. But the lives of education children are being used as, we're being used as guinea pigs to see what really happens when you abandon social distancing. And this is what it boils down to, the fact that we are being, these are test centres for that to happen. But I fully support the speakers so far. It's been a fantastic and informative meeting, so thank you.
Thank you very much, Tom and Alison, for your contributions. I think people will be quite shocked by a lot of what they've heard, a lot of what you've reported from really the front lines of this crisis, so to speak, and will be, I'm sure, sort of moved and encouraged by what you set out to get involved with the building of rank and file committees. And thank you also to Nigel for your question. I should say Nigel has sent his thanks to Tanya for her answer. I'd encourage people at this moment to particularly to ask any questions of Sue or of Benjamin, who spoke on Australia and the United States. It's really an excellent opportunity for people to hear from very experienced campaigners, people with a lot of specialist expertise about what we can learn, frankly, from the situation that's developing in these countries. Before then, though, I would like to move to our next speaker, Philip Frisch. Philip is a secondary school teacher from Germany, and he has played a leading role in establishing a student safety committee in Dortmund in North Rhine-Westphalia, and he's going to speak to us about those experiences. Welcome, Philip.
Okay, thank you very much, Tom. Right, so before I speak on the situation in Germany, which the homicidal campaign to reopen the schools has created, I would first of all like to give fraternal greetings on behalf of students, teachers, and also members of the Socialist Equality Party in Germany to all listeners on today's forum. Also, thanks for inviting me and giving me the opportunity to speak to students, teachers, and parents in the UK, and to everyone listening in from other parts of the world. So Tom has already introduced me. I'm Philip. I'm in teacher training at a secondary school, and also a member of the German sister party of the Socialist Equality Party, that is the Sozialistische Gleichheitspartei, or SGP. And I also think the contributions by the other speakers have been quite illuminating, and it is remarkable, despite all the differences in detail, how similar the situation in other parts of the world, including the UK, of course, actually is to the one in Germany and also the rest of Europe. And since the beginning of last month, schools in Germany have started state by state to return to regular operation at the end of the summer holidays, even though the infection rate had already been on the rise and had reached levels last seen in April. And when the first students and teachers went back to their schools after the break, the number of infections had already risen to 1,000 new cases each day, and it's been going up since. At the same time, the vast majority of safety provisions that successfully slowed down the spread of the virus were either loosened or abandoned altogether. In schools, all the safety precautions that had been worked out by educators, students, and parents when the pandemic hit Europe were thrown overboard. There are no lessons with fixed groups of students and teachers anymore, and no extra rooms were required by the educational authorities to keep the different groups separated and to ease the overall situation in overcrowded schools. And the last speaker has spoken on this. And even the requirement to wear masks and the provision to keep a minimum distance were suspended. And as the Socialist Equality Parties and the World Socialist website have stressed in many articles, the pandemic did not hit a society that had been in good shape otherwise before COVID-19 emerged. Rather, the virus has thrown a torrid spotlight on a society that had already been in an advanced stage of economic, social, political, and also moral decay. And I'm sure that many of you could speak at length and have already done on what concrete form this decay takes on at schools in the UK. And in many classrooms in Germany, it is not even possible to open a window in order to make sure that fresh air can come in and to prevent the virus from spreading with airborne particles, not to mention derelict buildings and poor sanitation, of course. A recent study that examined classrooms in North Rhine-Westphalia, the most populous state in Germany, found that about half of the classrooms were unfit for use. And with regards to the applicable health and safety regulations, they could only be described as unhygienic, the study said. And of course, this is not only the case in one particular state or at one particular school. And this alone is probably enough already to give you an idea of what is bound to happen when all of the 11 million students and 800,000 teachers will have returned in the rest of the 16 states by September 14th. There have been many reports of infections in states that have reopened already, even though teachers were muzzled by the authorities in many cases, which they pointed out in discussions with our party and also World Socialist website reporters. And the sinister logic behind all of this becomes ever more clear. After the reckless efforts to drive workers back to their workplaces so they can generate profits for big business, banks, and the stock market, their kids are herded back to schools and kindergartens so their parents have no reason to stay home any longer. Like many other governments, including, of course, the British government, Germany has effectively implemented the strategy of herd immunity, and I think Benjamin has already spoken. Well, it was important that he spoke on this and give an idea of what this really means. So Germany has effectively implemented this strategy, that is the unchecked spread of the virus across the population, although here it was done in a more concealed way. The relatively smaller number of COVID-19 infections and related deaths in Germany, that has always been a case of more luck than judgment on the part of the ruling class, is bound to explode now that every measure of protection is being abandoned. The back to work and back to school campaigns were carried out by political parties of all shades, whether it be the Grand Coalition government of the right-wing CDU and the Social Democrats, the Left Party state government in Thuringia, or the Greens in Baden-Württemberg, not to speak of the neo-fascist AfD. In a political formation that carried all the signs of a conspiracy against the population, they all agreed that restrictions must end, and they were supported by every available trade union. While the IG Metall, the largest union in manufacturing, announced the destruction of at least 300,000 jobs in the metal, electrical, and car industry, and got out plans long in the drawer for companies on how to get rid of workers, the educators union, GEW, critically accompanied the reopening of schools. And in a particularly cynical move, the union declared that risk groups are safe to go back because the employers were obliged to observe the very health and safety regulations that they had violated for years. And the initial lockdown measures that were implemented months after Chinese authorities had warned about the virus were very much the outcome of massive pressure upon ruling circles exerted by strikes and other action by workers in the factories and at other workplaces. The political atmosphere created by the lockdowns was then used to bail out banks and corporations on a scale that is without precedent, surpassing even the bailouts after the markets crashed in 2007 and 2008. However, once again, although even more visibly, the capitalist system stood naked and everyone could see that it's rotten to the core. Implicitly, the banks and corporations admitted that they were not able to stand on their own feet for even 10 years, let alone provide for masks or ventilators. And that is in a system that is dominated entirely by their own rules and interests. And in its crisis, capitalism regurgitates, as Trotsky said, undigested barbarism. All over the world, the ruling classes return to the most reactionary practices and thought. In Germany, the back to work and back to school campaigns were accompanied by propaganda with distinctly fascistic overtones, featuring politicians, media commentators, pseudoscientists discussing the value of life, or rather, one has to say, the value of death and sacrifice. In an article in the leading German news magazine Der Spiegel, Bernhard Gill, a sociologist who is close to the Greens, advocated for awareness about the fact, quote, that our life is unthinkable without death. In what was one of the most chilling pieces in the press, Gill argued that those who wanted to fight the spread of the disease by all available means would also fight death by all available means. A policy of herd immunity was perhaps, quote, painful for those individuals involved, but if you look at it from a distance, it also makes room for new life, end of quote. And Wolfgang Schäuble, the president of the parliament, and this means he also is the second highest politician in Germany, declared that what was protected by the constitution was human dignity and not life or health. And his remarks were not only absurd from a legal standpoint, but also extremely ominous and frankly politically criminal. And accordingly, many lawsuits by teachers who had sued local authorities over being forced to work in unsafe and potentially deadly conditions were rejected by the courts. Many of the plaintiffs belong to risk groups who are particularly vulnerable. And a number of teachers reported to the World Socialist website that there is no protection whatsoever for risk groups any longer. In fact, what is effectively taking place at schools at the moment is survival of the fittest. The ruling class in Germany has reacted to the resistance by workers with the cultivation of far-right and fascist forces to ram through their agenda on the streets. The most recent and perhaps most alarming expression of this were the far-right and neo-Nazi protests in Berlin with over 30,000 participants that demanded an end of the coronavirus dictatorship, as they say. That is the end of all restrictions. And the protest culminated in a storming of the Reichstag, that is the German parliament, that was prepared in chat groups over weeks. And one must assume that this took place under the eyes of the intelligence agencies, which target various left-wing groups, as well as as my party, the SGP. And only 3 policemen were guarding the building, which amounted to an invitation to the neo-fascist protesters to gather on the steps outside and wave the flag of the Kaiser's regime. That is the authoritarian regime that banned socialist organizations and sent worker soldiers to the carnage of World War I. And this took place while another 3 policemen were prominently featured as speakers at the demonstrations themselves. Although the organizers had threatened that they will not observe hygienic provisions, the ban on their protests was lifted by the courts last minute. And only a couple of days earlier, a scheduled large anti-fascist demonstration in Hanau, where a fascist gunman had killed 9 migrants earlier this year, was not allowed to assemble because it was declared too dangerous in a pandemic. There is, however, enormous opposition both against the fascist thugs as well as the reopening of schools. Social media is full of students worrying about their health and the health of their families. Teachers opposing the homicidal policies by the Ministry of Education and also sharing grievances, and parents who refuse to send their kids, many with underlying conditions, back to school and possibly sickness and death. And this opposition has taken on concrete form recently as students from Dortmund in Germany's former industrial heartland took a courageous step and formed a rank and file committee at their schools with the help of the SGP. And this committee was soon joined by teachers and parents, and more committees are in preparation. So we welcome and encourage the opposition in the working class. What is necessary now is the formation of rank and file committees, which are independent of all bourgeois parties as well as the unions. As an answer to the general attack on the capitalist ruling elite with mass layoffs and the policy of herd immunity, the committees have to prepare for a general strike to save lives and fight the capitalist system, which is responsible for the death of hundreds of thousands. Therefore, what this opposition urgently needs is an anti-capitalist, that is, a socialist perspective. And the Fourth International has rejected the ruling class's slogan saying, the cure must not be worse than the disease, which means in plain language, of course, that there will be no policy that impedes the flow of capital and the further enrichment of the already super rich. And we made one thing very clear, that the pandemic is only a symptom, the disease is capitalism, the necessary treatment is a unified international struggle by teachers, students, parents, and the entire working class, and that the cure is socialism. And so with that, I would like to appeal to every listener to make a decision to support the formation of rank and file committees at schools and workplaces that coordinated this proposed treatment across borders, and also to become a member of the Socialist Equality Party. So thanks very much for inviting me, and I'm also looking forward to the rest of the discussion. Thank you very much.
Thank you very much, Philip. And as you mentioned, we are now getting quite a few questions coming in, and a number of people have their hands raised to speak. So I'm going to move straight to them. The first, I think, who put their hand up was Harvey in the chat. Again, if the organizer could unmute them, same procedure as with others. And then Harvey, if you unmute yourself, I'll let you know when you can be heard. Hello. That's
Hello.
it, we've got you. Thank you.
Hello, right. Okay, so I'm Harvey, and I've been in the socialist movement for 30 years now, and during that same period, I've worked at a number of schools and early year settings, and I'm very pleased to speak here, and thank you for the opportunity given me to speak. I'm currently working as a teaching or classroom assistant in a primary school in an area of high social deprivation. Briefly, my recent school experience has been the following. After a period of a few weeks after lockdown, I worked with a handful of key worker children in my school, and then this was followed after June the 1st, the partial opening of schools by the Johnson government, in which I worked in a bubble, a class so-called bubble of 8 children. It was really during this period I became quite conscious of the fact that, you know, this initial experiment, it was perhaps just about possible with those few number of children within a classroom to socially distance and to adequately follow, on paper at least, the guidelines which were being presented at the school. Obviously, this is with, you know, with all of the traditional furniture removed from the classroom. Then in this recent period, in this week, the staff received 2 training days. these largely consisted of at best cosmetic or at worst irrelevant protocols and policy documents that totally sidestepped, of course, the main issue, namely that the fact that the school, along with all other schools, was about to reopen to all pupils in the middle of a deadly pandemic. I myself now work with children as young as 3 years old. At this age, it's a very physical environment. It is virtually impossible to effectively communicate with children at this stage of development, let alone enable them to play and learn and receive cognitive stimulation without closer contact. Just in the last 2 days of schools being fully open to in-person teaching, I've known of cases that of colleagues and staff in other schools who, for example, had to argue for face visors or buy them out of their own pockets in order to help children with tying of laces, helping them with their coats, a traditional developmental challenge for very young children. In addition, I've heard that on Friday, at least 2 children are to join in the nursery part of the school who require assistance with toileting. These and other challenges, let alone the need to comfort a child who has fallen down or injured themselves, are ever present and now under the shadow of COVID-19 in all early year settings. The media inevitably focuses on the selected stories of relieved parents sending their children to school and children glad to see their friends again. Of course, both of these contain a grain of truth. Many parents will feel an enormous sense of relief after 6 long months to be told that their children can safely return to school. And children too, after being cooped up for months and only mixing in a very narrow circle of relatives, will understandably feel joy at seeing their peers in a place they had come to enjoy, at least to accept as an essential part of their social lives. But this initial scenario, the result and a combination of government propaganda and complicity of teaching unions, and we should also say collective finger crossing, is a world away from saying that schools are now safe and virus free. Nor, and as the speakers have pointed out, nor does it seek to recognize, or at least seems to actually obscure, the wide and deep-seated anxiety among the mass of parents and school staff who are being forced back into unsafe schools and workplaces, which they're conscious of. This is not to mention the psychological impact on children in being placed in these circumstances. And it is this feeling of anxiety and opposition, outright opposition, that has found its way now on a global scale in significant numbers to the only organisation that is offering a viable alternative plan of action. And that is, of course, the Socialist Equality Party, with its call for a general strike to stop the deadly reopening of schools by the establishment of education rank and file safety committees. In conclusion, I wholeheartedly support this initiative and encourage all listeners to become fully involved, and not just to find out about the really vital initiatives in the sphere of education, but also to find out about what the auto workers are doing in the United States under the aegis of the SEP in setting up rank and file safety committees in their workplaces, and to gain really a fuller picture of where the working class is now in battle against what is not just the pandemic, but a question of the system of economic and political oppression, which has led to this situation itself, where society itself is at threat, and the only really consummate and all appropriate response is a unified international socialist response on the part of the working class. Thank you.
Thank you very much, Harvey. I think the question of what level of care and whether it's at all adequate can be provided to children, even if distancing and public health measures are observed, is a hugely important one, and one that really undercuts the propaganda spouted by the government and its media, that they have the best interests of children at heart. Thank you for the contribution. We also have wanting to speak Liz somewhere in the chat. So if we could unmute Liz, then unmute yourself, and we'll hear what you have to say as well.
Can you hear us?
Yeah.
Yeah, I agree very much with the opening report by Tanya and the international speakers. Firstly, I'd like to say that I'm a long-standing member of the Socialist Equality Party, and I've also have worked with vulnerable children and families for decades, both in schools and support services. The speakers have already explained the propaganda and lies that are pushed out by the government and its lackeys in the Labour Party and unions is unrelenting. There's a constant pressure to accept reassurances that are given, especially when it comes to vulnerable children and their families. These layers were particularly affected in lockdown and beyond. One example of this was the free school meal debacle, where vouchers did not arrive for weeks. These could only be used at certain supermarkets when most had no transport or could not leave their children. Some others have had to reserve their vouchers, especially in the school holidays, not knowing where food was coming from, and they were not also not allowed to use food banks if they're getting vouchers. It took a footballer, Marcus Rashford, to shift the government on extending this to the school holidays, a measly £1.4 million compared to the huge sums that are being given to businesses to bail out, to the huge sums of the bailout. These same families are now faced with a forced return, and many families are struggling to afford uniforms for a situation where this is the first time their child has been into a school and also under the threat of fines. The threats and misinformation are directed against the working class and are class questions. And in lockdown, very little provision was given to these families and to tens of thousands of children to be able to do any of the work that was given to do online. Prior to COVID, in my role, I visit lots of schools, and it's a well-known thing that you avoid morning break, lunch, and the end of day due to a very busy changeover. And if you turn up too soon or a bit late to the school, especially in primary schools, you have lots of parents waiting in cars and in person inside and outside the school gates, chatting to each other, looking forward to seeing the children, and the children also looking forward to seeing them. In the last few days, I've seen a number of photos of crowded scenes as parents have taken their kids to school or collecting them. And as usual, the right-wing press seek to blame parents for this, doing this under threat of fines and lack of support for their child's education. It's also been reported to me that a lot of the guidelines that have been given are not being adhered to. For example, sitting forward facing in the class. Secondary children over 12 years old, which the World Health Organization has said should wear masks, are working in pairs, learning partners with no social distancing, not wearing masks. With the amount of subjects potentially, you've got 10 different partners, and even in areas where they should be wearing masks, they're not doing so, especially in areas where they're moving around and helping each other out. Now, one of the cities that Tanya referred to in her report was that of Bradford in West Yorkshire. Mariam Hack is the Deputy Director for Educational Learning in Bradford, and yesterday she said that there had been anxiety and worry about possible outbreaks, and that schools are very well versed with outbreaks and how to approach them due to illnesses like norovirus, and she stressed the need to go to schools. This is a city already in local lockdown, and a number of schools in the city have reported COVID cases in schools that opened last week, that is the last week in August. These schools are in areas of high social deprivation and live in multi-generational households. These schools have actually remained open, and they have said all other staff and students are attending as usual. A letter sent out by the trust, the Dixon Trust, who run the school, gives some general guidance regarding coronavirus and explains that any pupil who develops symptoms such as a new continuous cough, a high temperature, or a loss of or change in your normal sense of taste or smell should stay at home, and that's it. And to return to this question of this that this woman raised about norovirus, I mean, firstly, the comparison with other illnesses is part of the misinformation that's promoted. Just prior to Christmas 2019, there were hundreds of outbreaks both across West Yorkshire and the North East, where nearly 100 schools had to close as staff and students fell ill. Firstly, coronavirus is not norovirus, and when norovirus is live, school immediately closes. There's a deep clean, etc. And if you're in a hospital, the wards are taped off like a crime scene. And generally, children and schools can reopen after a short period. So basically, they're saying it's okay to stay open where cases of COVID because the advice is it is not as infectious among children. So there's a huge attempt to play it down and underestimate the infection rates. And another aspect of this is cuts to school nurses, which over many years has been decimated. In August 2019, the Royal College of Nursing reported that the number of school nurses has fallen by 30% since 2010, with around 2,100 working among the 32,113 schools in the UK. And the RCM blamed significant cuts in public health budgets for the dwindling numbers. Now, many schools do not have a dedicated school nurse. That role is usually done by first aiders. Where they do have a nurse, much of their time is taken up with safeguarding issues. So in most local authorities, the school nurses are shared across schools in geographical areas. And the schools where there have been cases in Bradford, for example, have been in the same areas under the same academy trust. Now, I'd just like to draw attention to some new research that was published in The Guardian yesterday from Queen's University Belfast. They're now saying that diarrhoea and vomiting could be an important sign of COVID-19 in children. Researchers say, leading to calls for the official NHS list of symptoms to be updated. The checklist for coronavirus in children currently includes just 3 symptoms: a high temperature, a new continuous cough, and a loss or change to the sense of smell or taste. The latter was added to the list in May. So now the researchers at Queen's University Belfast say they've confirmed that an upset stomach is a symptom of COVID-19 in children and revealed it appears to be a key sign of the disease. And I'm just quoting what the doctor who led the research. He said, in our group, diarrhoea and vomiting were more predictive than, say, cough or even changes in smell and taste. If you want to actually diagnose infection in children, we need to start looking at diarrhoea and vomiting, not just upper respiratory tract symptoms. Waterfield said that going by the current 3 recognised symptoms, testing symptomatic children would identify 76% of cases, assuming a perfectly accurate test, while adding gastrointestinal symptoms to the checklist would bring the figure to 97%. The study took place between 6th of April and 3rd of July and involved more than 990 children of healthcare workers from across the UK, aged between 2 and 15. None had been admitted to hospital with COVID-19. All had a blood sample taken, which was tested for antibodies to coronavirus, and data was also gathered on whether they had experienced any symptoms. Crucially, this was done before antibody results were revealed. The team found that 68 children, 6.9% of the total, had antibodies for the disease, suggesting they had had COVID-19, and half of these reported having had symptoms. The survey of teachers and parents by the Educators Committee showed growing opposition and strong support for the call for a general strike to oppose the reopening of schools. This must be actioned on. Capitalism and the ongoing drive for profit is at the heart of this deadly push, and socialism is the answer to the massive inequality workers and their families face. So the setting up of a rank and file committee is absolutely of the day to really pursue and to continue this work that has to be done. Thanks.
Thank you very much, Liz. We have a hand raised in the chat by Eliza. Could we unmute Eliza? Eliza, once that's done, you can unmute yourself. Two seconds, we're just getting to you in the chat so that we can let you speak. You should be free to unmute now. If you're having trouble unmuting, just let us know in the chat area. Otherwise, we will move to a question. We can come back to you if there are technical difficulties. Oh, we've got you now.
Oh, you are listening. Yeah.
Yep, we
Hello.
can. Go ahead.
Oh, so I'm a parent. I have 2 kids. I'd like to share my experience, but at the same time, I have concerns, and if someone can help me, because I feel I'm stuck in the middle of a situation that I don't have words to describe. So on Wednesday, it was first day for my kids, both. I have to drop them different times. It was okay. They reassure me that they will be fine in school, blah blah blah. Okay, for me, I was really concerned because I don't think they can apply the safety measures inside school, but I gave the benefit of doubt. I was gobsmacked when I was picking my kids, and they were all over each other. So it was insane what I saw. My immediate reaction was run and collect my kids, and I just enter the car and start crying. When I say cry, I never saw myself crying that way. Uh, no control whatsoever, because I was in my mind I was just thinking I'm killing my kids. So I know we are in a pandemic. I'm being forced to put them in school against my will. That is the first thing. But giving them the benefit of doubt, I had the feeling that I was killing them. Then I spoke with my kids to see if it was me overreacting, and they report to me that no hand wash whatsoever. Yes, they have hand sanitizer around school, but nobody is concerned washing hands or hand sanitizing hands. No masks, no social distance. The only thing was one of the teachers. He was using a mask because of his age. He's an old teacher and maybe he has any special health issue. I don't know. Something was happening with him. So my concerns, I have a reason to have my concerns. After this incident, I emailed the head teacher, the principal of the college, and I raised my concerns, and I asked him to explain me how my kids are going to be safe, and for him to explain me the meaning of the bubble, because for me there's no bubble. A bubble is like a unicorn. They don't exist at all. So yeah, he replied, and he told me the bubble, the bubble is not to have social distance, because inside the bubble they don't need to have social distance. It's just to let's say isolate the kids. If there's a COVID case, they can isolate the group. But again, that is a lie, because if one kid is infected, I think all school need to close straight away, because for sure they have symbols on that school, other schools. So if we think and we look to the real situation, um, it's not real. So I feel really, really unsafe, even more when my youngest, he has a mitochondrial disease. And yeah, I think me and other parents, we are stuck in a situation that, okay, I know my kids need to go to school. I know the importance of school and everything, and I'm the first one. I'm a very proactive mom. During the lockdown, I insist with my kids, we need to study. I did research. I was learning things, and remember things I already forgot. But yeah, I was a proactive mom. I want to collaborate with all this, but at the same time, it's not safe for my kids to go to school. But they are forcing us to send kids to school. I tried to speak with someone from the Education Welfare Office to give me some lights. What can I do? If I draw my kids, what is the procedure? But nobody's answered the phone, or they don't let me to reach anyone. So Monday is again a school day. I'm not sending my kids for sure, because I felt I don't ask for my enemy to feel what I'm still feeling. At the moment, I'm between the feeling that I don't know if they already catch something. I'm the worst mom ever. I'm killing my kids. I'm killing my family, because we work as a community. In the end, we are a community, and school is part of the community. So I don't know why I know why I'm being forced. I just don't know how to act against this, what I have in my hands, so I can fight against this. I have been online in groups, and I'm not alone on this, but we don't have the tools. I think together we have the power, but at the moment we don't have tools. So if someone can help me to fight against this and explain to me what are my rights as a parent that want to protect kids, because I don't feel I'm protecting my kids at the moment. So I just need help. I think me and other parents that are listening this at the moment, we just need help and support to fight against this government, against the principles that are being not cooperative with us. So I just need help. I'm asking help, just this. So if you can help me, I will be very, very grateful.
Well, look, Eliza, thank you so much for sharing your experience. I'm sure I speak for everyone when I say it's terrible to hear. It really is. But it really underlines the importance of what we're trying to achieve and organise with this committee. I'd strongly encourage you, if you've not already, to get in contact with us. That is obviously via the newsletter, to write into us, give us your contact details, and we can engage in a longer sort of one-on-one discussion with you about the specifics of your situation, people you have around you, and really, you know, how you can go about building a safety committee in your own area. At the same time, this leads into questions that were sent in prior to this meeting, which asked really, why is it that we've called for a general strike over this issue, and whether our idea of this fight for safety against the pandemic would include all sections of the working class and not just education. I think these speak very much to the concerns that you've raised. And I think this would be a good opportunity for Tanya to address some of these questions as well. Why have we called for a general strike, and what do you have really to say, Tanya, in response to what Eliza has raised?
Okay, thank you, Tom, and thank you, Eliza. And I think the sentiments you have just expressed, the anxiety, the concern for the welfare of your children, is shared by millions upon millions upon millions globally and within this country. There is a real fear amongst families, and it was expressed in some of the quotes that I raised in my report, that their children's lives are at risk through the policies that the government has implemented, along with their families. Many children do also go home to vulnerable families and grandparents, as well as their community. So what you express, as you said yourself, you know you are not alone. This is a very broad-based sentiment, and understandably so, because we are in the midst of a pandemic which has created devastation and loss of life, and continues to do so, and so many unknowns about it. And as Thomas said, we can assist you in this discussion, but above all, the challenges that you confront are really the same as every other worker and parent and student throughout the country, and hence why we insist on a unified approach to it. I mean, I think what you raise about the bubbles is so important, because the conception of the bubble is to allow infection. That's the whole purpose of the bubble, is that you have a bubble of up to 50, 20, 10, whatever it is, 30 in a class. And then when there is an infection, which they anticipate will happen, people will get infected, then you can isolate that bubble, supposedly, assuming there's track and trace and all the rest of it. It'll be slightly easier to be managed. So the bubble is based on allowing infections to let rip, basically, perhaps a better control. And that, of course, isn't the policy of the schools and of teachers, etc. This is the policy that's been implemented by the government and has been refused to be challenged by the unions and other political opponents. So the only means, the only mechanism that is possible for workers and parents and various sections to challenge what is a frightening and deadly situation is in a unified campaign, and it must be a political struggle. So yes, we can deal with the individuals, but nonetheless, as you say, there are no easy solutions to this. And you have the right to protect your children and to keep them at school if that's what you feel, and whatever support you need in that challenge, we're prepared to provide that for you, as well as many other parents. We will highlight it, we'll publicise it, and any challenge that parents take against this government and against the fines and everything else, we will support and mobilise support for it. I think in terms of the other questions that were raised, I'm sorry, I don't know the name of the individual who raised it. It talks about the, yes, education committees, but why not a broader committee of workers? I mean, firstly, that this is part of an offensive of the working class, but I think there are some specifics about education which are really worth understanding and appreciating, because there is a very profound significance to the reopening of schools that goes beyond teachers and educators. This is not an arbitrary decision that the Tory government has taken up and said, all right, next schools and so on. This is in essence part of its agenda for the reopening of the economy broadly, for sending millions of workers back into the workplace, and they cannot do it if educators oppose it. If there are no schools for children to attend, the agenda is blocked. So there is a very specific importance and significance of why we are focused on educators, what role they play in society and broadly within the community and within the economy. And it does reveal the tremendous economic and political strength that educators have, which they may not be conscious of, but they play a very profound role. And of course, our perspective is that this intervention, this struggle amongst educators must then be linked to broader sections of workers, as being referred to, auto workers, workers in different industries, in particular wholesale workers, meat workers, all of these sections who have been absolutely sacrificed really in this context. So I think the question you raise is important. Our initiative isn't limited to educators, but I think it is worth pondering and really working through why this sector is significant and why globally, at the same time, in every country of the globe, there is a real drive to reopen schools. It must be done. It's key. It's the linchpin of government policy, and hence why the significance and the importance of this initiative being taken up as broadly as possible across many, many schools and so on, and linked to struggles of workers and parents, as Alyssa has raised, because there will be support amongst parents for this. And I think and also in particular the issue of the general strike. Now, what the general strike poses is the question of power. When you mobilize workers and their industrial strength, you're challenging the government. The question is who rules and who governs the country? And we insist it must be the working class. It must take power through the general strike in order to reorganize the economy in its interest. And that's the significance of that call. I can't remember if there was another question, but I think just in summing up, I think this has been such a key and critical meeting and discussion. There's been many contributions that have been very powerful, and what is sort of really been reflected is the international character of this campaign, the international similarities in the struggles and issues that are confronting workers in country after country. That's what came out of Sue's contribution and Phillips' contribution, and it is, as he said, quite remarkable, the similarities of both the social conditions as well as the political conditions. You know, the betrayal and treachery of the old organisations, the attempt to subordinate workers to bankrupt political perspectives and programs and open them up to the risks and dangers, and at the same time the response there is to an international program and perspective. And in conclusion, I really do appeal for anyone who's in this meeting to participate and sign up to be a member. We will be organising meetings. We will contact you and organise further meetings and discussions and help you in your workplace and anywhere. We will be organising future meetings in the as part of this offensive that we have launched. There is in fact a meeting in the US just not long after this, earlier about 8 p.m. of workers in the United States who were mobilising under conditions where a strike offensive is erupting amongst educators in the United States, which will be very powerful impetus to the struggles of workers globally, which we support. And at the same time, just in conclusion, I do also want to urge you all to follow the WSWS. We have a very significant and important intervention and campaign in defence of Julian Assange, who's been a political prisoner for exposing war crimes. He is in arbitrary detention and confronts hundreds of over 100 years of imprisonment in the United States. His case begins tomorrow. There will be protests that have been organised. We are participating in this, the defence of democratic rights and civil liberties. I mean, he has spoken out. He is a whistleblower, and our policy is to defend whistleblowers against the criminality of the ruling elite in its war crimes against many millions across the globe. So do participate in that. You can get further information through the WSWS on our website. So in concluding, thank you very much for your participation, and please do leave your name and contact. Phone numbers are really appreciated so we can have a conversation with you in order to develop this and hopefully organise another meeting within the next fortnight to continue this discussion and this initiative. And in the meantime, please build it, discuss it amongst workers and others in your workplace, community and so forth. So thank you very much for your attendance.
Thank you very much, Tanya. Unfortunately, as you've indicated, we are coming to the end, just a little over actually, the advertised time for this meeting. I think it's been a very successful event. Our speakers have clearly detailed the situation confronting education workers and also parents, and they've set out a strong political perspective for the fight that now has to be waged to defend their safety and their lives and those of society at large. I'd really like to thank all of them, I'm sure on behalf of our attendees, thank our speakers for their contributions today. Of course, this is only a first step. We will announce an upcoming meeting. We'll continue publishing our newsletter. As Tanya said, we encourage people to sign up to that newsletter, to begin joining, form the basis for setting up committees in their area, to work to build support for it in their communities. And we thank you all very much for your attendance, and we hope to see you at that next meeting. Thank you very much.